Hugging the banks of the eternal River Nile in Egypt stands the oldest and largest medical institution in the Middle East, KasrAlAiny Faculty of Medicine and the hospitals of Cairo University. The School of Medicine and Annex Hospital, inaugurated under the leadership of Claude Bey more than 175 years ago, is the country's leader of education and medical services. Deeply rooted in the heart of Egypt, KasrAlAiny is providing educational and medical services to the extensive population of Egypt. Deeply rooted in Egyptian culture, KasrAlAiny is also home to an extensive medical museum, housing a collection of paintings, sculptures, photos, inscriptions, and documents spotlighting the work of its pioneers. Adjacent to the museum lays the ceremony hall with a seating capacity of 900. The hall witnesses the annual graduation ceremony, Additionally, the hall is utilized for a wide array of scientific seminars, conferences, musical concerts and cultural events.
كلية الطب بيدرس فيها في الوقت الواحد حوالي 7,000 طالب.
Currently, the Faculty of Medicine oversees 7,000 undergraduate students and 3,000 teaching staff.
من العاملين ما يقرب من 10,000 موظف وعامل في خدمة.
Additionally, the Faculty of Medicine employs 10,000 staff members, including 3,000 nurses and assistant nurses. KasrAlAiny is also responsible for approximately 9,000 postgraduate students from all over Egypt and neighboring Arab countries.
الأشقاء العرب من البلاد العربية.
Originally, the Faculty of Medicine included students of medicine, dentistry, pharmacology and nursing. In 1955, the faculties of pharmacy and dental medicine were separated and a high institute for nursing was established within the faculty campus. The Faculty of Medicine is also equipped with a variety of classrooms, lecture halls and laboratories for practical training. The faculty contains an up-to-date library, continually stocked with the latest scientific references. After graduation, the majority of graduates enroll in postgraduate studies in the various specialties of the medical school. Under the supervision of approximately 3,000 teaching staff, students begin a training program that includes on-site bedside training as well as theoretical studies. The students are privileged to use the enormous postgraduate library stocked with current international standard technologies. The Faculty of Medicine grants diplomas, master degrees and PhDs in a variety of different academic and clinical disciplines. The KasrAlAiny Medical Education Development Center plays an important role in education of students and researchers alike, providing the required audiovisual aids. The center provides a variety of scientific and educational material, including books, printed material, slides, and educational CDs. Additionally, it provides training courses and workshops in the fields of scientific research and medical education. The center also hosts its own print house and photography lab and administrates and updates the faculty's website. KasrAlAiny also publishes the quarterly Cairo University Medical Journal. Let us introduce you to some of the outstanding graduates of our KasrAlAiny. Importantly, KasrAlAiny plays a leading role in healthcare provided by its hospitals. Cairo University hospitals have a capacity of more than 5,200 beds, shared by the Mania University Hospital, Internal Medicine Hospital, the Emergency Hospital, Pediatric Hospital at Abu Rish, the Specialized Pediatric Hospital, as well as the new KasrAlAiny Educational Hospital and Al Mania Specialized Hospital. Combined, our hospitals provide free medical treatment to about 1,500,000 patients per year.
بيشرف القصر العيني إنه
KasrAlAiny is honored to be the main treatment center for Egyptians from all over the country. KasrAlAiny hospitals host 3,500 free beds in addition to some other services at economic rates. Since the establishment of KasrAlAiny, every attempt is made to keep both our staff and our facilities up to date with the aspiration to effectively deal with the ever-increasing requirements of the Egyptian community. Units of special interest. Units of special interest are specialized centers that provide distinguished medical and educational services. During the past years, 39 centers were established. Now we will visit several of these centers. The Critical Care Center has 3 separate units with more than 75 beds. It includes a multi-purpose care unit, a cardiac care unit, plus a transitional care unit. This integrated center caters to patient needs. Yearly, an average of 2,500 heart disease and critical patients are admitted. The center is also equipped with the most up-to-date diagnostic technology. The gastrointestinal and hepatic endoscopy unit is fully equipped with the latest diagnostic and interventional tools in the field of gastrointestinal endoscopy for the diagnosis and treatment of more than 10,000 patients per year. The Radiation Oncology and Nuclear Medicine Center provides treatment to 50,000 oncology patients per year, including chemotherapy, and radiotherapy. The center's biological oncology laboratories examine more than 100,000 cancer patients per year for early detection and follow-up with tumor markers. The Medical Diagnostic Imaging and Interventional Radiology Unit, complete with the most up-to-date radiology diagnosis equipment. Our center includes 3 CT scanners, 2 MR scanners, plus 2 scanners for angiography and interventional radiology, and screens up to 170,000 cases per year. Ophthalmic Diagnostic and Laser Unit. This centre was established for the early detection and treatment of eye diseases by means of laser. It includes 2 operating rooms and provides medical treatment for over 2,000 patients per year. The cochlear implant unit specializes in the treatment of profound deafness in adults and children with hearing and speech disabilities. Equipped with the latest hearing and speech rehabilitation tools and surgical equipment, the unit performed more than 30 cochlear implant surgeries in the past 2 years. The Mania Specialized Hospital was inaugurated in 1997 as a unit of special interest. It is a private hospital dedicated to economic treatment and offers outstanding medical services at a lower cost than other private hospitals. The hospital includes several outpatient clinics and specialized departments such as the bone marrow transplant unit, the cardiac care unit, the respiratory care unit, the neurology and neurophysiology unit, and the hospital also comprises 3 operating sections, each containing 3 fully equipped operating theatres, in addition to 5 wards for the inpatients. The new KasrAlAiny Educational Hospital, also known as the French Hospital, houses 1,208 beds equipped with state-of-the-art equipment and medical technology. Outstanding medical services at reasonable rates are provided by the best physicians and university teaching staff. This hospital includes a fully prepared emergency unit and an operating section with 18 operating theatres containing the latest equipment and surgical instruments. The inpatient section provides high standards of accommodation and competitive medical facilities. Since its inauguration in 1996, 550,000 patients were examined in the outpatient clinic, and more than 75,000 operations were performed, as well as the treatment of over 100,000 inpatients. It was awarded the ISO 9001 from the American Registration and Accreditation Organization. KasrAlAiny is not merely a medical school or a treatment center, but also plays an effective role in serving the society.
قطاع خدمة المجتمع وتنمية البيئة أحد القطاعات الحيوية النشيطة.
Community services and environmental development are equally vital and active sectors within the institutional structure of KasrAlAiny Faculty of Medicine. Our compassionate medical convoys span out and around remote areas of Egypt to examine patients and perform surgical procedures. Recently, our convoys were sent to Iraq to re-educate the doctors and nursing staff and assist with medical services to the state of Iraq. Our Preventive and Social Medicine Center in KasrAlAiny Faculty of Medicine administrates and performs preventive studies, birth control services, and numerous medical treatment services for children. Over the past 2 decades, the infrastructure of Mania University Hospital has continually been modernized, and the latest information technology system was introduced in order to serve the faculty and hospitals. MedNet Center was founded for the purpose of integrating information technology in the medical education and practice. The center maintains an electronic library with databases for the latest references and medical periodicals. It offers its services through the internet for members of the teaching staff and unaffiliated researchers. The telemedicine service was introduced at MedNet as a new philosophy to provide consultation and medical intervention for patients and doctors in Egypt's remote areas. MedNet also provides a broadcasting system for international medical conferences. KasrAlAiny surgical robot system is the most current information technology acquired by the hospitals to enhance surgical techniques. Pediatric hospitals. Specialized Pediatric University Hospital, Abu Rish University Hospital, and Preventive and Social Medicine Center. Receiving more than 500,000 children per year, the pediatric outpatient clinics are the most frequented clinics of all university hospitals. They offer their free services of treatment and surgeries through 800 beds for over 22,000 patients per year within the inpatient sections. The Pediatric Hospital Emergency Unit is the #1 pediatric emergency reference center in Egypt. It receives more than 100,000 patients per year. Fully outfitted with an intensive care unit and 2 operating theaters, the specialized pediatric hospital contains 9 operating theaters equipped for a range of specialized surgeries. The hospital has a dedicated unit for treatment of heart disease, equipped with 2 cardiac catheters for normal and interventional catheterization with a capacity of 800 cases per year. Recently renovated, the Abu Rish Hospital in Munira has several specialized units. The Kidney Disease Center with its dialysis unit, where an average of 700 monthly sessions of hemodialysis and peritoneal dialysis are performed. The gastrointestinal unit was established for the treatment of gastroenteritis to respond to Egypt's mounting efforts against dehydration among